Hi. Medical noncompliance is a failure or a refusal to comply. These words are commonly used in regard to a patient who does not want to take a prescribed medication or follow a prescribed course of treatment. There are several reasons why a patient would want to discontinue their medication. The cost of the medicine itself could be high, or they could be unable to pay for it. The patient could also have a high out-of-pocket deductible. And to be honest, they may be embarrassed to go back to their doctor to disclose this to them and merely may choose to discontinue the use. Non-adherence could be due to the side effects of the medication prescribed. If the medication makes the patient feel bad, the patient either may reduce the dosage amount on their own or they may choose not to take the medication altogether. One way to handle it would be for the patient to go back to their doctor asking about other treatment options in order to see if there's another way to treat their illness or disease. Another thing to consider is the relationship between the patient and the physician. If it is properly communicated just how important the medicine is to treat the ailment and in what ways the medicine would help, the patient may be more likely to continue medication as long as the doctor sees fit. After all, rapport has been built. On the other hand, a lack of knowledge on the patient's side could end up negatively impacting them. This is something a physician should consider when speaking with patients about the medication they are being prescribed and in what ways it helps or impacts them. Also, an explanation regarding the importance of finishing out the dosage amount for the days prescribed would help provide the patient with clarity so that they understand the reasoning behind the doctor's decisions. Other reasons why a patient may not be taking their medication they are prescribed is that they are feeling a lot better. They may think to themselves that they have been treated and are well enough to continue without following the doctor's orders by continuing the medication. If a patient feels as if they are well and want to stop taking their medicine, they need to at least reach out to their doctor to see if it would be safe for them to do so, or to see if the doctor would like for them to continue the treatment first prescribed. The patient also needs to consider whether or not they will feel withdrawal side effects, especially if they are being treated for a psychiatric condition. There are risks associated with medical noncompliance. A patient may have physical and/or mental side effects if medication is discontinued. If a disease is being treated and the medication is working, a patient may feel well. Let's say they discontinue their medicine altogether. The illness, let's say a virus or infection, could come back in greater force if it is not treated for the number of days first prescribed. The virus or infection may be going away, but what if it is not completely gone? Also, if the medication is for a lifelong disease, discontinuing the medication could result in the worsening of the disease or withdrawal side effects being felt. One strategy for addressing medical noncompliance is to devise an automated calling system. This would be something that the doctors put in place. This calling system would call patients that have current prescriptions in order to remind them to take their medication. A part of this could be an option to press 1 in order to speak with a nurse, or to press 2 in order to schedule another appointment. I think this would be beneficial in helping patients, especially those with memory problems. And it would also allow patients to be reminded if they need to schedule a follow-up appointment with their doctor.